Good evening, everyone. Dr. Monday is here again. Today I'm going to be presenting on the appendix. So what are we going to talk about on the appendix? We're going to describe the appendix. We're going to look at the anatomy, the blood supply, and the embryology, the pathology. Now for the pathology, we're really going to focus on appendicitis. We'll look at the causes of appendicitis, the signs and symptoms. How do we diagnose appendicitis? How do we manage? What are some of the complications really that we could get from appendicitis, and differential diagnosis? So I'm going to describe the appendix in details. The appendix is a small pouch-like sac of tissue that is located in the first part of the colon, which is the cecum, as you can see in the picture right there. The appendix is about 4 inches long, and if you prefer to use centimeters, it's about 9 centimeters long. Like I said previously, again, the appendix is attached to the cecum, and so it's typically located in the right lower abdomen. Now, in terms of the function of the appendix plays a role in immunity. It's said to be a storage for good bacteria, which usually help to suppress pathogenic bacteria in the body. The appendix is supplied by the appendicular artery, which is a branch of the ileocholic artery, and this is a branch of the superior mesenteric artery. Now, embryologically, the appendix is derived from the endoderm, which forms the gut tube, and the part of the gut tube that the appendix comes from is the midgut, which is why it has the blood supply from the superior mesenteric artery. Now, in terms of pathologies, there are 2 main pathologies with the appendix. One of them is appendicitis, which is what this discussion is all about, and the other is carcinoid syndrome. Now, carcinoid syndrome is a paraneoplastic syndrome where there is excessive production of serotonin. I'm going to discuss carcinoid syndrome in details in another lecture. Now, appendicitis is inflammation of the appendix, and with appendicitis, there are 2 main causes in adults and children. It actually differs. Now, in children, the appendicitis is said to be caused by lymphoid hyperplasia, and then in adults, it's said to be due to obstruction of fecal content, and that's why we have the fecalith. Now, these are the main causes of appendicitis. There are other causes you would see, but I'm focusing on only the 2. Now, what are some of the signs and symptoms people with appendicitis present with? So very commonly, they will tell you about a pain that appears in the umbilicus and radiates to the right lower quadrant or migrates to the right lower quadrant, which is again the location of the appendix. Now, the appendix can be localized in the McBurney's point, and I will talk about that very soon. In addition to the pain that they have in the umbilicus that moves to the right lower quadrant, they also have fever, vomiting, anorexia, malaise. So these are some of the things that people with appendicitis will present with. Now, how do we diagnose appendicitis? One of the things we really have to do is we have to perform physical exam, and there are certain examinations that we do for appendicitis. Now, the few of them that I have here is psoas sign. And psoas sign basically is when they have pain in the right lower quadrant when there is extension of the right leg against resistance. So when you put pressure, so you tell the patient to raise their right leg, you put pressure. If they feel pain in the right leg, in the right lower quadrant, then that is appendicitis, that is positive psoas sign. Now for obturator sign, they would again have pain in the right lower quadrant when you flex the leg and you internally rotate the right leg. So with flexion and internal rotation of the right leg, if there is pain in the right lower quadrant, this again can be a positive sign of appendicitis, and this is referred to as obturator sign. Now, Robson sign is also another one that is seen with appendicitis, and basically what this is that deep palpation of the left side, the left lower quadrant, will produce pain in the right lower quadrant. Then we also have Dunphy sign, which is when the patient cough and then they have pain in the right lower quadrant. Now, another classic sign or another common sign that people see with appendicitis is hamburger sign. And personally for me, I actually remembered this because it was asked to me on the rounds. Now, the doctor tells you that if you have a patient you suspect has appendicitis and you offer the patient food and they still want to eat their favorite meal, they're telling you that the patient most likely doesn't have appendicitis. So anorexia is very common in majority of patients with appendicitis. So that's the hamburger sign. Basically, the patient refuses to eat even their favorite food. Now, how do we diagnose appendicitis? Now, many times appendicitis is actually diagnosed clinically, which just means that it's based on the patient's presentation and your physical exam. But sometimes you might need to get more clarification, so you could order a complete blood count, which is what I called here as CBC, and so you would see elevated levels of white blood cells, which is referred to as leukocytosis. Now, in other cases, you might need to do ultrasound and CT scan. Now, ultrasound is actually the preferred for pregnant women. So if you have a pregnant woman who you suspect could be having appendicitis, but again, because she's pregnant, you're not exactly sure, you would definitely not do a CT scan. Instead, you will send her for an ultrasound. Now, CT scan is actually said to have a 98% sensitivity for appendicitis. Now, what are some of the complications we have with appendicitis? Now, one of them really is perforation. If it perforates, this could lead to collection of pus, and then this leads to abscess formation, and can also lead to peritonitis. And in rare cases also, appendicitis can be a cause of obstruction in the bowels. And so what are some of the things that you might confuse with appendicitis? So of course, for a reproductive female, one of the things you could think about would be ectopic pregnancy. So it's important that when you have your female patients come in with appendicitis, you want to ask them about their gynecological history. So you want to know when was their last menstrual period. Also, pelvic inflammatory disease. Again, this will be on the right side, so this might be confused also with appendicitis. Now, diverticulitis can also be another differential diagnosis for appendicitis. Of course, again, it has to be on the right side. And Crohn's disease can also be a differential diagnosis for appendicitis. Then also, another thing that could mimic appendicitis is what is referred to as pseudoappendicitis, which is caused by bacterial infection. Now, there are many bacteria that could cause appendicitis, but the two main ones are Yersinia enterocolitica and Campylobacter jejuni. So these are gram-negative rods actually that cause gastroenteritis, and they might also cause, they might mimic appendicitis. Now, in terms of treatment, for now, the standard of care really is to do surgery, which is basically appendectomy, so they would remove the appendix. Although new studies have actually been showing that medical treatment, just giving antibiotics, is enough, but I'm not sure it's been approved so far, and so for now the treatment of choice is actually surgical removal of the inflamed appendix, and of course we also give antibiotics to prevent further infection. Alright, so these are practice questions for you guys. Pain in the right lower quadrant with extension of the leg against resistance is... Alright, figure it out. Let me know your answer in the comment section below. And question number 2 is, we have a 28-year-old female who is currently 16 weeks pregnant. She's complaining of pain in the right lower quadrant that started 3 hours ago and has worsened. She also has nausea and vomiting. She denies vaginal bleeding or abnormal discharge. Physical examination is positive towards an obturator sign. The intern decides to do an imaging technique for this patient. So which one do you think is the most appropriate for our patient? Please put your comments below. Thank you very much for following us, and we hope you join us next time. Take care. Bye. Study, study, study. Take care.